Hi, everyone. This is Dillon with Catalyst, Montana. We're hearing a lot of chatter about changes to Medicaid and SNAP that will be happening this year. Catalyst is releasing a series of videos we're calling Case Denied, how Medicaid and SNAP are becoming harder to access, where we will be clarifying what is happening to these programs, what it means for our communities, and how you can get involved to influence these changes. Last time, we talked about 2025 and how state and federal policy changes got us here. Today, I wanted to dive into one of the central pieces to the Medicaid cuts, which are work requirements. You might hear people refer to them as community engagement requirements, but just know when you hear community engagement, think work requirements. Like we mentioned last video, our state health department, DPHHS, has indicated it wants to implement work requirements by July 1st of this year. So folks should be getting prepared now for these changes. There are a lot of different aspects we can talk about when it comes to work requirements that we can get into in another video, but I wanted to address two pieces today: employment and cost savings. I want to be very clear. Work requirements don't actually increase employment. They don't actually save states money, but they do disproportionately harm people already struggling to make ends meet, especially caregivers, students, and workers in unpredictable jobs. You might think work requirements are simply there to make sure that people on Medicaid who can work do work. But the fact is, 2/3 of those on Medicaid are already working, and an overwhelming 96% of folks on the program either are working or face a barrier to work, whether it be attending school or taking care of a loved one. The notion that folks on Medicaid are not working is just false, and it's used to justify kicking people fighting cancer, gig workers, caregivers, you name it, to kick them off the program. It's not that people aren't working, it's that the state is imposing more bureaucracy on people's lives who are just trying to get by. And speaking of bureaucracy, these new requirements are going to cost the state a lot of money to impose. DPHHS has estimated that it will need to hire 59 more staff to adequately implement all the changes in HR 1. Hiring this much more staff is going to cost $4.3 million. Now, the federal government will cover 75% of the cost, but that still means Montana taxpayers will be paying over $1 million a year just to make it harder for folks to access Medicaid. This isn't government efficiency or wise financial spending. We are paying more money to cover less people on the program. This is the opposite of common sense. It's just cruel. Medicaid helps our neighbors and families stay healthy enough to hold a job or care for their loved ones. These work requirements will waste taxpayer dollars on paperwork and faulty bureaucracy instead of focusing on the real solutions that strengthen our communities. Do you or someone you know have a story about work and Medicaid? Stories are powerful and can help change the narrative around work requirements and help create positive change. Please reach out if you do. Fill out the form in the description so we can get in touch and uplift your story. Next time, we'll talk about who will have to comply with these requirements and what exemptions might exist. Thank you.